India is in the midst of an unprecedented health emergency. The second wave of COVID has brought our healthcare system to an absolute brink of collapse. There's a shortage of beds, oxygen, medication. At a time like this, to address your concerns and answer your questions, we have with us the head of the All India Institute of Medical Sciences, Dr. Randeep Guleria. Dr. Guleria, thanks for sparing the time and being with us. India's COVID crisis at the moment, how can we combat this unprecedented surge that we're seeing?
So in my mind, we have to have two sort of pronged attack. One is we need to urgently work on increasing the health infrastructure, whether it be bed, whether it be oxygen, whether it be medication. The second prong has to be decrease the number of cases. We cannot really continue to have such a large number of cases because this has a cumulative effect and more people will therefore need hospital care and more people will get admitted, and therefore the burden on the healthcare system will become much more. Therefore, to do that, I think we need to look at areas where the infectivity rate is very high. If the infectivity rate is high, there should be a strict containment. We could call it even a lockdown in those areas so that there is no, the chain of transmission is broken and the number of cases come down. If we continue to have such large cases for many days, it will actually cause more and more strain on the healthcare system. So we need to improve the healthcare system, but also work aggressively in decreasing the number of cases.
You know, it's been unprecedented in terms of lives lost due to oxygen shortage of medical oxygen. How can this crisis be resolved? We continue, Dr. Guleria, to get SOS phone calls from hospitals, from patients. It's a very desperate situation.
It is a desperate situation, especially as far as the national capital is concerned, and therefore we need to see how we can allocate our resources properly. There are areas in our country where there is no oxygen shortage, there's surplus of oxygen, especially in the eastern part. We need to move oxygen quickly from there to the central part of the country. Need to develop more rapid oxygen plants, which will see that we don't have this shortage ever again. And at the same time, work on strategies that how can we in the short term get oxygen from various sources to really tide this crisis. And like I said, also work on decreasing the number of cases, because if the cases increase, the demand for oxygen will also continue to increase.
You know, you say that it's a question of allocation. There is surplus in several other parts of the country. It needs to be directed especially to the national capital. The question then is, did we not see this coming, Dr. Guleria? You know, we know now that there is the rapidly spreading UK strain here in Delhi. Should we not have anticipated this and prepared better?
Well, to some extent, yes, we should have. I think what was not anticipated was the rapidity with which the number of cases would increase. If you see what happened during the last surge, the number of cases increased at a much slower pace, and therefore one had time to really make arrangements and move things around, whether it be oxygen, whether it be drugs, or whether it be ramping up of the facilities in terms of camp hospitals and COVID care centers. This time it happened so quickly that I think it caught a lot of people unaware, and therefore the overall arrangements have taken time. And I think we should have been a little bit more cautious because of the fact that we do know that the UK variant is very, very infectious. And in the UK itself, especially the southern part of UK, it spread like wildfire. And therefore, when it reached India, it had a chance of doing the same thing.
Well, you know, you say that we were caught unaware by just how rapidly this UK variant has spread. The shortage of oxygen, of beds, of medication is very real in several parts of the country. Is a complete lockdown therefore the only way out? What do you suggest?
So I think that we will have to look at areas where we have, let's say, your positivity rate is more than 10%. Those areas should actually go in for almost a complete lockdown, because those areas are the ones which are contributing to the increasing number of cases and causing strain on the healthcare system. So a mechanism can be developed. It doesn't have to be a national level lockdown, but areas where your positivity rate is very high, you can take whatever cutoff you want. Those areas have to have some sort of a lockdown, because your healthcare system is paying the price of the spread of infection, and we have to break the chain of transmission. And if you're seeing it at very high in certain areas, we must really have a lockdown there, because lives are more important now, and we have to really bring the number of cases dramatically down if you really need to come out of this acute crisis.
Well, we are in an acute crisis. According to your assessment at the moment, when will India's cases peak?
That is a tough question. It will depend on, again, how aggressively we're able to contain the spread of infection. I think it will take another few days or maybe another, I would say by the early next month, only that we will be able to say that the peak is over and we're coming down. It's a tough question. In my rough estimate, it's going to take another 2 to 3 weeks.
Right. How can India flatten the curve amid this surge? There are different points of view. Many say it's a combination of vaccination and public health measures as well. But it's extremely important for those measures to kick in. How do you think India can flatten the curve, especially amid the surge?
So there are multiple things that we need to do, and we need to do them aggressively. One is, of course, aggressive COVID appropriate behavior. Second is testing, tracking, treating, and isolation, so that everyone who is positive, we track and isolate all the close contacts so that the chain of transmission is broken. Like I said, in areas where your positive rate is high, have a complete clampdown, make it into a containment zone, but make it into a containment zone where there is no movement at all. Everyone is tested there, and you don't allow the infection to spread out of that containment zone. And finally, ramp up your vaccination so that more and more people get vaccinated as early as possible. And of course, do very aggressive surveillance and prevent the formation of crowds, because they can be super spreading events.
Right. Vaccination for all adults from May the 1st is the decision that's been taken. All those above the age of 18 will be eligible to get the vaccine. The question, therefore, that many are now asking is, do we have enough vaccine doses?
So I think that is going to be a big question, and therefore we need to work aggressively on getting as many doses as we can, both from the Indian manufacturers and from abroad, so that we are able to meet the demand. It's not going to be that everyone can be vaccinated on day one. It will have to be in a graded manner, and that strategy will have to be developed by states as they move forward. But this is a good move so that we are able to really have a large number of our population vaccinated as in a short period of time to really break the chain of transmission. But this is going to be a big challenge as to how we are able to achieve this huge number in a short period of time.
There is also talk of the fact that, we've liberalized our rules in terms of the number of vaccines that can now come in. Many young people, therefore, have questions on whether they should wait for a foreign vaccine, whether they should just, get whatever vaccine is available right now. What would you like to tell them?
So I would say that get whatever vaccine is available right now. We know that both the vaccines which we are giving in India are also helping people. There is now data emerging that those who have been vaccinated are having much milder disease, and some of them, and there's good amount of protection. So therefore, whatever vaccine you get, whether it's coming from outside, whether it's available in India, please take it, because we need to have a large number of people who are vaccinated to break the chain of transmission and bring down the number of cases.
Dr. Guleria, there are 2 or 3 points of worry as far as RT-PCR tests is concerned, and I know you've addressed this in the past as well, but there are several symptomatic patients, some even who have severe COVID symptoms with declining oxygen levels, loss of smell and taste, who are testing RT-PCR negative. What should such patients do?
So like I have said in the past, RT-PCR test can be negative because it has a sensitivity of around 80%. That means 20% times it can be, people may be having COVID, but the test may not pick it up, especially if your viral load is not that high. And also, if the test is not done properly, if the swab is not taken properly, you may be negative, which will be a false negative. So you have to go by what we call clinico-radiological laboratory profile. If you have clinical symptoms, if the lab report or the CT scan is classical, and you have come in close contact with a COVID positive patient, or you are having someone who is COVID positive, or the symptoms fit in classically, you must assume that you are COVID positive, and we must start treatment as we would for a COVID positive patient.
Right.
That strategy we have to take.
Right. There's also concern because several symptomatic COVID patients who are testing RT-PCR negative are then not being able to get admitted into COVID facilities. Do we need to, given the fact that this is happening, do we need to relook at the hospital admission policy? Is there any other way that we can do this?
Yes, I think so, because what we were doing in the past was that we were very worried that those who are negative, and you may be negative, but your symptoms may be related to some other illness which may mimic COVID. And therefore, we were saying that this should be the gold standard, and in a COVID center, you should come only into this area. Some hospitals like AIIMS have also built what we call a COVID suspect ward. that you have all features of COVID, when we suspect that you may have COVID, but you're not turning out to be positive. We treat you as COVID, but you don't put you in a COVID center so that you're not exposed to other COVID positive patients. That strategy can be done. But I think if we have a surge of cases like we're having right now, anyone who has classical symptoms, has a CT which is suggestive, and has other lab reports which are also confirming that this could be COVID, even if your RT-PCR is negative, I think he should be admitted in a COVID center and be treated as a COVID patient.
Well, I think that's very, very important what you're saying, and will perhaps go a really long way in saving lives. Dr. Guleria, given the oxygen emergency that we're seeing, a lot of our viewers have asked questions on what can patients do to maintain oxygen levels at home, given the fact that they don't get emergency treatment or critical care that they may need.
First of all, I would say don't panic. You must remember that even if your oxygen level is around 94 or 93, it's all right. We have the oxygen dissociation curve, which usually says that even above 90, your oxygenation is good as far as oxygenation to various organs in the body is concerned. You could also lie on your stomach. You could lie prone and take deep breaths, because lying on your stomach actually improves the diaphragmatic function and your oxygenation actually becomes better. And therefore, what we call prone positioning or conscious proning is also one way of improving oxygenation. And at the same time, doing some deep breathing exercise along with that will also help. At the same time, you must consult your doctor so that you are being closely monitored, because if the saturation falls further, then you will need to come into a hospital.
Right. You know, just looking at the reports of oxygen SOS that's coming in from several hospitals in Delhi, even different parts of the country, there is panic that is set in among several patients. Questions, therefore, are now being asked on who needs medical oxygen support and when. This is a very important clarification.
I think this is very, very important, because one of the causes, it may not be a major cause, but one of the causes of the shortage is because of the fact that there is a lot of hoarding which has started, and a lot of people have started taking oxygen when their saturation is not that low. And therefore, that is actually denying others who need oxygen more critically. Therefore, I would really suggest that what you need to do is that if you have your saturation, which is usually coming less than 93 or so, or you're feeling your respiratory rate is high, then only do you need to take oxygenation. You don't need to take oxygenation if your saturation is 95, 96. Many people are taking oxygen if they find the saturation, which was 98 yesterday, has come down to 96 today, they will start taking oxygen. And they have kept, I know people who have kept almost 10 cylinders at home. No, that is something we should not do. Because if you're going to start hoarding oxygen cylinders at home, you are denying oxygen in the hospital for someone who's critically ill. So if you are having breathless and your respiratory rate, when you're breathing normally, and you count your breaths per minute by a watch, if it is more than 24, or your saturation is actually hovering around 90, 93, then you can consider oxygenation. But if it is above 93, you are way above the buffer zone. You are not requiring oxygenation. As a matter of fact, some patients who are having long-term oxygen because of other chronic diseases were quite all right with the oxygen saturation of 88 and 90 in the past, and they were actually able to manage very well. So don't get into a panic situation and don't misuse oxygen is what I would really plead with everyone because of the current crisis.
All right, I think that's very important advice given the current crisis that we're facing. We're going to slip into a very short break. Dr. Guleria continues to be live with us on the other side. Stay with us. Welcome back. We're in conversation with Dr. Guleria. Dr. Guleria, as per the new treatment protocols, now Remdesivir has actually been removed from standard treatment protocol. When should Remdesivir be given, especially given the mad scramble for the injection all over?
I think it's important to understand what is the data as far as Remdesivir is concerned. Initial studies were actually negative studies and did not show that Remdesivir was of any use. As a matter of fact, the first study which came out of China was a negative study. However, subsequent studies did show that Remdesivir given for 5 days did decrease hospital admission by around 4 to 5 days, and therefore you could discharge patients earlier. But there was no decrease in mortality. It did not decrease deaths, and people who took Remdesivir or who did not, the number of people dying was the same. The WHO trial, the Solidarity trial, which looked at Remdesivir, did not really find any benefit of Remdesivir in that large trial. Therefore, Remdesivir has limited use, and that's why it's in the emergency use authorization. It's basically for people who are having severe disease, requiring to be in the hospital, requiring oxygen on the 5th to 7th day with the X-ray or the CT showing patches in the lungs itself. So those people may benefit from Remdesivir for 5 days, and that is when we are giving it. It's not been shown to be of any benefit if it's given earlier in asymptomatic or mild illness. It may have more problems because of its side effects also.
Well, that's important to note. So don't go out and get Remdesivir just in case, because it also has side effects and must be given under medical supervision. When should patients be given steroids?
So again, steroids are something which have really now been shown to be life-saving if they're given at the proper point in time. The recovery trial actually, which was the largest study, showed steroids could save lives and decrease mortality if they were given in those patients who were sick, requiring oxygenation. Those who did not require oxygenation, and when steroids are given in the early stage of the disease, actually did worse. There was a higher morbidity and mortality in the group which received steroids if it was given too early. And I think that has been shown by the H1N1 pandemic also, that if you give steroids too early, it promotes viral replication and the disease may become more severe. Steroids are useful when the viral replication has come down, and in COVID, when you're going towards an inflammatory response or a cytokine storm, where if we give steroids, we can suppress that, and therefore then you will come out of it without much problem. Therefore, the timing of steroids is very important, and it's usually given a few days after, usually between the 5th to 7th day, and when you are deteriorating and your oxygen requirement is going up, or you're needing oxygen.
Right.
In the early stage, again, steroids have no use.
Okay. Doctor, there's a shortage of drugs like FabiFlu and ivermectin that's being reported. How important are these drugs, and are they substitutes for these medications that can be given?
So Favipiravir is the first drug which was mentioned, and the other is, of course, ivermectin. Both are drugs where there is some data which shows that they may help as far as viral replication or viral load is concerned.
Right.
However, a large number of studies have not been able to show they're of much benefit. So there is a lot of debate in the medical community whether they are of any use or not. There is no robust data, but if you look at large, what we call meta-analysis, which an analysis of large number of studies, the data is equivocal. So therefore, in mild illness, we do give ivermectin, we do give FabiFlu, but I don't think we have enough evidence to say that they make a dramatic difference.
Okay.
In the West, in UK, in Europe, or in the US, none of these drugs are given, and patients with just supportive treatment come out of their illness if they have a mild problem without taking either ivermectin or FabiFlu. So I think we need more data before we can say one way or the other.
Right.
But they are very commonly used in our country.
Okay. But if you don't get them, it's not a cause for panic.
It's not an issue at all.
Right. Young children and COVID, a lot of young children are contracting COVID-19. Do they get the same treatment as adults? Are the same kind of drugs being given to them? What's the protocol?
Same type of protocol can be used at the All Institute of Medical Sciences. We've now put up a protocol which is also available on our website, the ministry's website, of how to manage children with COVID-19. We need to give the same dose, but we need to modify the dosage according to the child's body weight and take a risk-benefit analysis as far as certain drugs is concerned, because we don't have enough data as far as the safety profile of these drugs is concerned.
Right. Dr. Guleria, there are unconfirmed reports at the moment, and this is coming in right now, that the AIIMS emergency has been closed to new admissions because of a shortage of oxygen. Is that true? What would you like to tell our viewers?
No, there's no shortage of oxygen as far as AIIMS is concerned. We have 3 or 4 centers. The National Cancer Institute in Jhajjar, which is a COVID hospital, we have almost 600 patients admitted there. Our trauma center, which is having around 260 patients admitted with COVID who are COVID positive, and our main emergency, which looks at non-COVID trauma and other cares also. And of course, the other hospital, the cardio-neurology center. All of them have oxygen. But the issue is that it's a constant supply, but currently we have enough oxygen in all of these areas. There is a huge demand for oxygen points in our emergency, and we are trying to adjust that so that we can create more oxygen points, because we have a large number of COVID positive patients who need oxygen in the emergency, and that is something that is being done. So a readjustment is being done in the emergency right now.
All right. So, but it's open to new admissions. Patients can go to the...
Yeah, and there's no oxygen shortage as of now.
All right. Dr. Guleria, before we let you go, it is very desperate times and a lot of people are seeing a lot of despair, reading about it constantly. What's the advice? What's the message that you'd like to give out?
I'd like to say that, we have to look at both ends of the spectrum. First is we have to really improve our healthcare infrastructure. We need to really work aggressively in that, and we need to improve hospitals. We need to come up and have more hospital beds and oxygen beds to come over this crisis. But that can never be infinite, and therefore we have to work on decreasing the number of cases. And to do that, all of us have to come forward and make sure that we break the chain of transmission. This virus spreads from one human to the other. It's a human-to-human chain. So if we as humans are able to prevent the spread of infection by maintaining COVID-appropriate behavior, always wearing a mask, maintaining physical distances, avoiding crowds, the virus cannot spread from an infected person to a non-infected person, and we will not have so many cases. Unless we decrease the number of cases, the healthcare system will not be able to manage the huge surge. Therefore, we have to have COVID-appropriate behavior, we have to avoid crowds, and at the end of the day, we will have to develop aggressive containment zones or areas where your case numbers are high, your infectivity rate is high. They will have to go on to some sort of a containment or lockdown.
Dr. Guleria, thank you for sparing your valuable time and being with us at a time like this. And most importantly, thank you so much for your service at these times.
Thank you. Thank you.